Good evening, everyone. All right, good evening, everyone, and welcome to Atp Live Monday. Um, all right, just trying to first share the video and just make sure everybody can see us. All right, good evening, welcome to Atp Live Monday. I am Minister Lavide and I'm your host for today. All right. Yes. Okay. I think I'm good now. All right. So welcome everyone. How's your day been? This is ATP Live, where you get to ask any question that you may have about the health of your children and get immediate answers live. Thank you so much for joining me. So let's just first share the video and may invite family and friends to join us as well. My Instagram is looking different today, but okay. But it's good that you guys can see. Let me know whether you prefer the new layout or you prefer the old one. All right. Okay. I'm just going to also share the video, and then we can start. So welcome to ATP Live Monday. ATP Live Monday is brought to you by Atp Pediatrician's Foundation. It's a program where you get to ask any questions that you may have about the health of your children, and you will get your answers in live and direct. We have just 60 minutes to do that. Um, but if after the program or if you are just joining us late, and remember that you can still watch, you can still post your question on our Facebook group Mondays to Saturday, and we will still be able to answer your questions. So no worries about that at all. Okay, I'm just trying to share the video and pin it in our various groups so that people can see us and can hear us. So just pin post. Okay. So welcome everyone. And if you have any question, feel free to start to drop your questions. Remember to start with the age of the child. That's the most important aspects. You know, some of us ask questions, but we don't put the age of the child. For a pediatrician, it's so important for us to always put the age of the to know the age of the child to have the right context. Okay, so apart from the age, then you can summarize the concerns with the child, and then please make sure you give specific information about the child and ask very specific questions that you want us to address in that about your concerns with the child. Don't just give us information without being very specific about what you want us to do with that information. So I think I'm ready now. Just a couple more minutes to pin the post, but I think I'm almost ready. Um, okay. Okay. All right. So we can start now. Okay. I think I've done all the sharing and all the pinning. Welcome everyone to ATP Live Monday. This is a program where you get to ask any question you may have about the health of your children, and we'll get to answer it in 1 hour. All right, I can see there are some few questions already on Instagram, so we're going to start. Miss Wiggle, I hope I've not missed anybody's question, but thank you to all of you joining us on Instagram. Miss Wiggle said, good evening. My baby is 7 months and not rolling over in both ways. Okay, so a 7 month old definitely should be rolling. So we usually rolling is 5 to 6 months. Your baby born preterm or baby born term, because that's another thing we need to be sure of. Because if your baby was born preterm, we need to correct the age of the child, and so that we're sure we're not giving the wrong information. So please check, let us know whether your baby is term or not. And so but at 7 months your baby should be able to should have neck control, and your baby should start to sit, at least sit with some support. Even some babies should start sitting without support by 7 months, unless the baby was born premature. So if your baby was born premature, we need to calculate. Okay, if your baby was born at term at 38 weeks and it's not yet rolling at 7 months, I would recommend you see a pediatrician, because that could be a sign of developmental delay. But is the child able to sit? Does the child have neck control? These are more important for us to be sure of. Okay, so but definitely your baby should be doing more than that. Yeah, so if a baby can sit with support, then that baby should be able to roll. There's no reason why baby cannot roll, because for a baby to sit without support, it means baby should be able to get into the sitting position by herself. And there's no way baby, if you put your baby flat, so how did your baby get into the sitting position? So that baby should be able to roll to get into that sitting position. When we say sit without support, we are talking of a baby who is able to get themselves into a sitting position on their own, not the ones that you are the one putting them to sit, because that is not here sitting without support. So sitting without support, the baby should be able to get into that sitting position on their own, and that will require for them to roll from the front to the back and then for them to sit. So rolling is usually preceded, so the developmental milestones are usually sequential. There are things that must happen before the next thing happen. There are some things that will not happen before the next one. So for example, a lot of people ask questions, my baby can see, but baby doesn't have neck control. It's impossible. So the child will have neck control before they can sit, and most babies will be able to roll before they can sit without support, because there are things that work along each other. So it's either you are not quite sure of that information, or, or you've not seen it, but you may want to get a doctor to check. But these are things that doctors will be able to do. So if your baby is not able to roll and you say your baby is sitting without support, I doubt that is correct. So if you are putting the baby in sitting position, most mothers put the baby in sitting position and think the baby is sitting, but it is not our own definition. Anybody can be put in any position. It's whether the baby can stay. So when the baby is sitting without support, their back will be straight and they don't need to have anything holding them, and they will sit. And most baby will get into that position on their own. So you may just want to cross-check. Anyway, I would still recommend you see a pediatrician so that we are sure of the child's developmental milestones. But there's really no reason why a baby should be able to sit and not be able to roll. Okay, Laurie Tamal is saying good evening. We missed you last week. Yes, sorry about last week. I think I missed the time change. And by the time I was able to connect, my laptop was just messing up. So apologies, I couldn't meet up last week. But I'm happy I'm here early today, so we could have our meeting. But at least I'm happy that you noticed I was not around last week. Thank you. All right. So Mrs. Wiggle, I'll recommend that you just see a pediatrician. We can easily check these milestones for you, and then we can let you know if there's any concern or not. All right, Facebook people, ask your question. No, I can't see any question on Facebook. I hope you all can see me. And please, if you are on the Facebook group, make sure you click on the video so that you can put your question directly under the video. Otherwise, if you just drop your questions in the group, I won't be able to say it from the studio. I can only see what you drop in the under the video directly. So Facebook, I've not seen any questions. So I hope all is well from Facebook department. All right. So so if you have any questions, still feel free to ask your questions. And welcome everyone to the month of November. Happy new month. I think this is a yeah, I have not seen anybody in November yet. Okay, this is the first episode in November. So happy new month, and we're almost going to the end of the year. The month of November is significant because we celebrate a lot of stuff in November. We celebrate the World Pneumonia Day. We celebrate the World Prematurity Day. So there are lots of things that we tend to talk about, and so watch out for that. And for those who are wondering what I was asking whether the baby was preterm or not, because a lot of preterm mothers also worry about their child's development. For preterm babies, before we can look at the development and growth, we have to correct their age. We have to subtract the number of weeks they were born early. So if they are born like 4 weeks earlier, we have to subtract the 4 weeks from their current age or their chronological age to get the corrected age, and that is what we will now use to assess the developmental milestones. Otherwise, that we may not get the correct information. All right. So that is just about preterm, and usually for preterm babies, they will always have a pediatrician monitoring them anyway, so that they can check the development is fine. All right, so I think I'll leave it at that. All right, I can't see any questions from Facebook and Instagram, so I've answered the ones I've sent. So I hope people are not dropping the question in the wrong place, but let me just check. All right. While we're waiting for the questions, I would just like to address the issue of colds, because we seem to be getting lots of questions around colds and cough and catarrh. Obviously, we are now in the season where it is getting cold, and a lot of mothers are worried about their children having cough and catarrh and cold, and how can they kind of protect the children or prevent it. And most people sometimes have them, unfortunately, the name, when we use the word cold, so to refer to what we have called respiratory infections, acute respiratory infections, a lot of mothers assume that means that children have cough and catarrh or cold, in codes, because of the weather. It's a weather thing, so that's why they call it codes. Unfortunately, that's a very is a misnomer. The name we use is actually wrong. We shouldn't be calling it codes. It has something to do with cold. All right, it has something to do with the weather. Of course, we tend to have them more during certain season, maybe when the weather is wet and cold, but it is not the weather itself, it's not the temperature that is causing respiratory infection. So when our children have cough or catarrh or sneezing a lot and a runny nose and all that, it is not the fact that the weather is cold that is making them to have colds in colds. It is actually an infection. Okay, so most children who have colds have it from germs. There are germs which we're all familiar with. You have the viruses, you have the bacteria. So those are the ones causing those infections. It is not the weather per se. Of course, the weather has its own contribution, in the sense that some viruses or some bacteria tend to be more common during certain season. Okay, so that is one. And of course, also the body system that protects our children against respiratory infections, they tend to be uh, weakened by cold weather, in a way. Let me put it that way. So, of course, we don't want the children to be cold, but just to clarify that it is not the weather, the temperature, that makes the children to actually have those infections. And it is not whether they sleep on the floor or they sleep on the mats that make them to have. So a lot of Nigerian mothers believe that if the children sleep on the bare floor, concrete floor, then they're going to have pneumonia. That is a myth. Or if the children are exposed to cold, then they're going to have pneumonia. That is also a myth. Or if the children have too much breeze blowing on them, they are going to have respiratory infections or pneumonia. That is also a myth. So those colds and coughs and catarrh are caused by germs, and they are what we call respiratory infections. You know, they are airborne, they are in the hair, and they tend to happen a lot in places that are overcrowded. And for most school age children, the most common reason why they all tend to have this cold uh, is being in school environment, because there are lots of other children who have colds and they are all there together. And so because they are all there together, it is easy for them to cough and sneeze and breathe into each other. And when they do that, they release a lot of those germs, viruses, bacteria, and the other children breathe them in as well. So it is during that process that they exchange the germs. And if the child's own ability, the natural what we call immunity, the ability to fight those infections, if it's not strong for any other reason, then it is easy for the children to not have coughs and cold. And unfortunately, because children keep going back to school, so when one child is getting better, the other children are still having their own, so it becomes like a vicious circle, because by the time the child is better and they go back to school, they're exposed again. So that is why it tends to be common, especially when children are in school. And so unfortunately, it would have been easier if the school say if any child is sick, they should stay at home. But most parents also don't want to keep their children at home because they have to go to work. So that is why everybody comes to school and everybody are exchanging the germs, and that's why we tend to have a lot of those respiratory infections, especially during the time when children are hauled back to school. But the most important thing is to maintain good respiratory hygiene and to make sure that our children's immunity are actually very strong. And we'll talk about how we can do that. First, we want to make sure our children have good nutrition, because when they have good nutrition, they are eating fruits, vegetables, the vitamin C and all those will be high, and they will be able to cope with fighting some infection on their own. The body will naturally deal with those germs and not allow them to cause problem for the children. That's so. Then also smoking, whether cigarette smoke, whether firewood, or even our generator fumes, they damage certain protective organs in the body, what we call the cilia. So those are the like part of the respiratory system that when those germs come in, they kind of sweep them away very quickly. But when the children have been exposed to smoke, cigarette smoke, they kind of damage the cilia. And that is also what happens when the wet temperature is cold. They become very slow, inactive. So they don't quickly clear away those germs, the viruses or the bacteria, and that is why they have time to settle in, and then it's easier for that child to get infection. So, which is why we must make sure that we keep our children away from smoke generally, so that they don't damage their airway. And of course, we make sure that our children are immunized. Immunization, let them take all the vaccines. There are certain vaccines that protect against respiratory infection. Measles is one of them. Haemophilus influenza type B vaccine protect against bacteria. Also the pneumococcal vaccine. All these are part of the penta vaccine. They protect our children against certain germs that can cause pneumonia, cause respiratory infection. So we need to make sure the children are immunized. They are eating well. They are not exposed to smoke and things that can affect their airway. And keep them away also from people who have colds and cough as much as you can. I know it's difficult when they're in school, but keep them away as much as you can. And those are the things we can do to protect our children during this period. Okay, I'll go back to our question. So Blessing Hada has a question. What causes otitis media? Okay, otitis media is just a medical jargon for hair infection, what we call the middle hair infection. So our hairs are divided into three parts. So you have the part that you can see, which all those parts that you have touched your hair rings. That's what we call the external hair. If there's infection on that one, we call it otitis externa. So that's the external hair. But you also have that narrow passage, that's where most of us tend to put our cotton bud and stuff. We call them the middle hair, the middle part of the hair. So um that part, if there's infection in there, that's the part of the hair that extends to where you have the hair drum and all that. If there's infection there, we call it otitis media. And then you also have the innermost part of the hair. So that is what we mean by otitis media. So it's just infection of the middle part of the hair. And the way you notice is that most children will start complaining of hair pain, and if you touch their hair, they will scream, it will be painful, or they can actually have what we call hair discharge, like pus coming out from the hair as well. Those are the symptoms that you see in otitis media. It's caused by infection. It can be just the same kind of infection that caused what I was talking about, the respiratory infections, the cough and the colds and the catarrh and all that. The same kind of viruses, they can also cause infection in the inner hairs. And in fact, the hairs and the respiratory system, they are all linked together. So infection from one can actually spread to the others. So it could be viruses, and all the different viruses. I will not bother you with their names. It could also be germs, bacteria, like all your what we call the staph, the streptococcus, so many germs that can cause. You can even have, for children who have chronic kind of ear infection, they can even be caused by even fungal and all that. So germs generally cause hair infection. So your doctor will determine whether this ear infection is caused by a virus, which means the child will not need any treatment because it's going to go by itself, or it is caused by a bacteria, in which case the child will need antibiotics treatment. So if your child has ear infection, they're complaining of ear pain, they have ear discharge, you need to take the child to the hospital. Doctors have a way of looking into the hair. So we have what we call our otoscope, horoscope. Basically, it's just something like torchlights. We will shine it into the hairs and we look, and we will see whether it's looking red. Is we can see the pulse bulging out there. We know that that is hair infection, and we can prescribe antibiotics. The most important thing is that when your doctor prescribes the antibiotics, make sure you complete it, because some of us don't always finish taking all our antibiotics. So make sure you complete the antibiotics. If they say it's for 10 days, it's 10 days. Don't just give it for 5 days, and because the child is no longer complaining of pain, you stop. You must give it. So you can also give them paracetamol if they're having fever or if they're having pain. So that is how we treat ear infection. Another thing to avoid hair infection is that stop putting things in babies' ears. A lot of mothers, so I can see wax, I can see the hair is dirty, I want to clean it, and they will go and get the cotton board, and then they start cleaning the hair with the cotton board, which is very, very dangerous. And we can perforate there's a what we call a membrane that separates the inner hairs and innermost part of the hair. So if you can perforate it, and that can cause uh, hearing loss for the child. So avoid putting anything in the hair. You don't need to put anything in the children's hair. The wax is part of the cleaning mechanism of the hair. It's take away all the dust and it kind of drains them out. So most of the time it will flow out by itself and you can just clean it. But if it is so hard and it's thick, you can just put an olive oil, just a drop of olive oil. It will make it softer and it can flow out. Please stop trying to put anything in the ears, or trying to use cotton board or anything. Don't put anything in the children's ears. If you think there's something there, or the children have put something in their ears, don't try to bring it up by yourself. Take the children to the hospital and the doctors will take care of it. So I hope, blessing, you got the answer to your question. And of course, we don't recommend you do self-medication when it comes to antibiotics. Because a lot of mothers always writing, asking questions. They will tell me, I have treated this, I've given this, I've given antibiotic. You are not supposed to give antibiotics on your own. A doctor must always prescribe antibiotics. I know it's a problem for us in Nigeria, but in other countries, you can't actually buy antibiotics when a doctor has not prescribed it, because antibiotic abuse. And when we abuse antibiotics, we give rise to what we call antibiotic resistance, and which means that it is so easy for those children to um, uh, when they actually need the antibiotics, the common antibiotics we normally would give them will not work. So that is a problem. So we don't want that. So there's a lot of what we call antibiotic stewardship. Even for all doctors, when we're prescribing antibiotics, there are certain rules we follow. So which is why it's important for us not to abuse antibiotics. I see it a lot, but it's wrong, and it's not. It's also for the benefit of our children that we don't abuse antibiotic. All right. There's a question here from Jim Victoria. Good afternoon. Good evening. My 3-month-old has or recently started throwing up. Okay, and she got upstairs. She shakes, and the next thing to vomit. She's crying, and you don't quickly respond. She start coughing, and the next to vomit. We're going on for 2 weeks. No fever, no cough. It is actually not normal for a child to be vomiting. Okay, that's no, though in your own case I think is there's some scenario here. So number one, if your child is sucking and they seem to be sucking and they are not taking a breath, it is okay for you to pause the breastfeeding and let the child kind of let the milk go down before the kid, because there's a process between sucking and swallowing, and it has to be well coordinated in children. So because the airway and the foodway, what we call the trachea is the airway, the foodway is the esophagus. They are actually in front of each other, and both of them open into the same passage, what we call the pharynx. So if there's no proper coordination, and that is why people say don't talk when you are eating, because food can go into the wrong pathway. So the food will want to go into the airway, and that is why the child may want to throw up, because it's kind of a protective mechanism to make sure that food should not go through the airway. So that's why it's so important, so that children are able, when they are eating, they have to close the airway, and then they open, then they have their breath, and then food can go. But I guess when your child is gulping in here, there's a loss of that coordination at that time. Maybe that is why. But it should not be something that should be happening all the time. Okay. The fact that if the child is crying and they start coughing, that's also not normal. So obviously we don't want you to be leaving your child to be crying for too long before you respond to them as well. So we need to avoid the triggers, since you already know the things that the scenario that normally leads to this child vomiting. You need to avoid that first. So that is number one. Okay, but if it persists and the child is always coughing, throwing up, we need to see a pediatrician. We need to make sure there is no problem between the airway and the foodway, and there is no unusual connection between them. Okay, so that is number one. But most of the time, it's just that sometimes when children are rushing the food, they are so much hungry, which means also that you've waited for too long before you feed them. So sometimes you have to just prioritize your child's food, and when they are showing you cues, you respond fast. You don't wait until the child has now cried so much, and then they are now rushing the food, then, because that time they are not coordinating the sucking and the swallowing properly, and they can easily choke down, and that's why they will start coughing and all that. So just make sure you recognize when the child needs to feed, you respond on time, you don't give room for all this unnecessary crying too long and coughing before the child gets attended to. That should take care of it. But if the child keeps doing that, even despite the fact that you are making sure, then you need to just see your doctors, make sure there's no there is no abnormality connecting the airway and the footway. So that is that. You said there's no fever or cough or catarrh. Yeah. So I just think it's just a matter of making sure your child is coordinating the sucking and swallowing well, and just avoid those scenarios that you have listed. And if you think the child is rushing the food, you can actually temporarily disconnect the breast milk, let the child take a little bit of a break, or let them catch their breath, and then you can resume breastfeeding. It's okay as well, so that they can do it slowly and well in a coordinated fashion. All right, so she has plenty of when can you start making a hair? That's your own personal decision. There's no law about it. If you want to start making your child's hair, you just make the hair. The most important thing is that you should not put too much traction. All this one we're tying the hair and it's so tight and it's pulling on the scalp. You just have to avoid that. But otherwise, in terms of when you want to start, you can start. You can keep ruffles. Make sure you if your child's hair is very difficult to comb, there are products for children's hair like disentangler that can make it softer for you to comb and all that. But if you think you are struggling with that, you can cut the hair short. There's no law against all those things. The most important thing is that the child is comfortable and you're able to do whatever you need to do without stressing the child. So, and we obviously hygiene is also important. Washing your hands, washing all the combs and everything you use on the child's hair, because we don't want the child to start having scalp infection. So I hope that is clear. Okay, Germany, Victoria, is it the same person? You're asking what causes sepsis? Sepsis just means there is infection, there are germs circulating in the blood. That is just the meaning of sepsis, and is when there is the child has got infection and a lot of germs circulating, mostly bacteria circulating in the blood. So it is caused by infection, again, germs. So that is what causes it. And it can enter the germs can enter through many pathways. They can enter through the mouth, through the nose, airway. They can enter through, dirty hands. They can enter into the blood directly, different method. But usually the word sepsis is not a word parents come up with. It's something the doctor would have told you, because parents do not come up with sepsis. For you to hear that word sepsis, it means you're in a hospital and the doctor is telling you. So I'm sure the doctors will know what to do. All right. Hede is asking, my daughter lost so much weight due to diarrhea. So it would have been helpful for you to tell us the weight. What was the weight before? What is the weight now? So usually when you're asking questions like that, we like the facts and the figures. It helps us to really know how to advise you. But usually if a child has had diarrhea, you must give them extra food. We say you must give them extra meals. All right. So you should be feeding the child extra meals at least for the next 2 weeks, so that hopefully they will regain their weight. But there's nothing extra to do beyond feeding them until they regain the weight. So that is what you need to do. Just give the child food, give more food, extra food. Somebody say, is it harmful to children? I'm not sure which one, what you're asking is harmful to children, because your last question was about otitis media. So when you say harmful, any illness is not good for children. So I'm not sure what you mean by harmful, but we definitely don't want children to have ear infection, because ear infection can proceed to brain infection. The brain and the hair are connected. It's just like the eyes and the brain are connected. So anything around your facial area, they are very important, because they can easily, lead to more serious infection like brain infection, meningitis, which can be fatal, which can kill children easily. So we don't want a child to have any form of infection, including hair infection and all that. So it's not a matter of something is harmful. It's a matter of something that a child should not be having in the first place. And if the child should have it, then they should be treated very promptly so that it doesn't spread further. I don't know whether that's what you're asking, but if not, please, you can re-ask the question and make sure it's complete. If you say something harmful, it's better to put what you are asking about being harmful in full sentences. All right. Oyetola, good evening. Talking of immunization, is MMR and chickenpox vaccination important? Because some private hospitals give this, which is not applicable in the government hospital. Okay, thank you. Yeah, both are important vaccines. So MMR is measles, mumps, and rubella, which we don't have in the country, but we have measles, but we don't have the mumps. But I think the government is introducing. We've just recently introduced the MR vaccine. So that is measles and rubella together. So that is a step in the right direction, but we still don't have the full components of MMR. But if you have the money, why not? You should go for it. So your children will be protected against mumps. Obviously, measles is the most uh, devastating of all the three of those vaccines. So measles, definitely, we want your children protected against measles because they can have lots of complications with measles, including malnutrition, including pneumonia, including meningitis. So we don't want measles. So we have measles is given at 9 months and at 15 months, measles 1 and measles 2. So we are gradually introducing measles and rubella. Okay, but hopefully maybe one day we will get to MMR. But if you have the cash, why not? You can get it because it's available in the country. It will protect your child against mumps. Obviously, mumps is not as deadly as measles virus, but it's still, if you can protect your child against something, it's best to protect them, and you don't have to deal with the illness if it comes. The same thing for chickenpox. Chickenpox is also important. So, it's either you want your children to have chickenpox or you can protect them by giving them the vaccine. Obviously, it's not like a killer disease. I think the government tends to prioritize the killer ones because one thing you must always realize that these vaccines are not cheap, even though you get them for free. I know most of us get these government vaccines for free, and some of us are not even going for them yet. So, but the government is paying huge amounts, millions of dollars to get us those vaccines. So the government had to prioritize which ones are the important ones. So, and then gradually they keep adding. Right now, I think malaria is our own primary focus because malaria is killing more children than chickenpox will kill them. So that is how government make the decision which disease is killing the children, which one is more significant. So they go for that first. So right now, I think malaria is what is we are trying to introduce as more important. But that does not mean that those vaccines are not important. It's just priority for the government. So, but if you as a parent, you have your money, you should go for those vaccines. So MMR is okay, chickenpox is okay. However, there are some things that private hospital gives that I don't recommend that you take for your children. Things like flu vaccine. We don't need to be taking flu vaccine for your children at 6 months. Even in countries where they have flu, like UK and they don't give their children flu vaccines at 6 months, at 9 months. Okay, things like that. So you don't need things like typhoid fever, cholera. Those vaccines are not recommended for children nowhere in the world. They are usually recommended for people who are traveling to where there's an outbreak of those, maybe cholera or typhoid. Those ones we don't recommend them as routine vaccines for children. So those are the ones some private hospitals do too much overdo, and they still give it to everybody because they just want to sell the vaccines, but they are not recommended for children really. So, but MMR, chickenpox, yes, we recommend that you give them to your children if you can afford them. And if you can't, you can wait until the Nigerian government introduce it, and then you can get it for free. But at least make sure you go for the ones that are free. Make sure we now have the HPV vaccine. We're going to get the malaria vaccine soon, and some already getting it, and we're going to have the MR vaccine as well. So there are a lot of new vaccines that we have also introduced. So make sure you go for those ones, and those ones are free. Okay. Ifama, good evening. Is there anything to worry if my 7-month-old falls from his soft mat that she was sitting on and hits her head on the mat that is on the floor? Do I need to get her a head helmet to protect her head as she's learning how to crawl and how to sit help herself. So most times she falls while trying when she's on a soft mad. Okay. So if your child is hitting the head on something soft and there's no major like injury and all that, obviously, I mean, I assume that you as a mom, you should be able to know if a child falls and they are not having any bruising, no swelling, they are not crying. I'm not going to recommend that you go to the hospital for that. But if there is a major, like the head is swelling up, they're crying so much, they're vomiting, then you should definitely take them to the hospital. But usually we don't want you to leave your 7-month-old unattended to. So it's not, a 7-month-old should not be falling a lot. If your child is not yet able to sit, then you should not leave them sitting on their own. You should be there with them. You should sit, they should be sitting with support. If a child is sitting with support, they are not going to be falling and they're not going to be hitting the head. So a child who is falling and hitting their head when they're trying to sit, it means that child is not yet sitting without support, which means that child should be sitting with somebody there, somebody supporting the child. So it's not a child you should just leave on their own to try and be sitting up and they're falling and they're hitting their head. That is not acceptable at all. So if your child is not yet achieved a milestone that they can do on their own, please don't leave them to do it. I know the children is trying to start doing those things, but you have to be there. You have to be there. A 7-month-old must never be left alone. So if the 7-month-old is not yet sitting independently, then that means an adult must be there when the 7-month-old is sitting down. And they should not sit for too long. We don't want them to sit for more than 5 minutes at a time, so that then they can have a break, because you're not supposed to force them to sit to the point that they are so tired and they are now falling. So even the sitting with support, we should say no more than 5 minutes at a time. And if after that, you just lay them on the back. If a child is lying on the back, they're not going to fall. They can roll up and around, but they're not going to be hitting their head. So falling and hitting their head means the child is in at a higher elevation, because for them to fall, or the child is sitting and the child is actually not able to sit independently, and then they are eating and falling. But we don't want them falling at all. So if you are not going to be there at that point, just put them on the back and let them lie flat. Then when you are back and you want them to sit, you sit and you are there supervising, so that even when they're about to fall or turn on their side, you can easily catch them. It's very, very important, because head injury in this age group is very, very serious. Okay, the brain of a 7-month-old, the brain of children less than 5 are still developing. So any little, what may look like to you as a little fall, for a baby whose brain is developing, can be very serious, because it can cause blood vessels in the brain to break and bleed in the brain. It doesn't have to be a big fall. Even just, that's why I say don't shake babies. All these people throwing babies up, shaking them. You shouldn't be doing that, because you are putting their brain at risk. They can bleed in the brain very easily. Their brain is still not fully mature. So there are tiny blood vessels, they can rupture easily and they can bleed into the brain. So we don't want anything that will cause that kind of scenario, because when that happens, that child is going to suffer severe head injury, and that can lead to disability. So children falling and banging their head should not be happening at all. And what it means is that children should be supervised, should always be with an adult until when they're able to. Even when children start to walk, we should not just leave them to start staggering and falling and hitting their head. We should not put children on cushion, on sofas and couches that they can roll and fall. No, we should never leave them in that scenario. We're going to put them on the bed, the guards have to be up. You have to be proactive in making sure we protect our children against head injury, because head injury can cause significant brain damage, and it can cause lifelong disability. So it's something that we don't even want to happen at all. So that is my recommendation for that child. So just always make sure they're supervised. Okay, Sarah Aman. Good evening, doc. My 2-month-old baby has catarrh. Sometimes she makes that sound as if the fluid is much in her nose. don't know what I can do. Okay, we've talked a lot about catarrh and cough and all that before you came. For a 2 months old, the most important thing is to keep them to protect them against respiratory infections by making sure you are breastfeeding them exclusively and keep them away from people who have cough and catarrh. Okay, keep them away from smoke, cigarette smoke, firewood, frying of oil, insecticide in the house, all those kind of things that can irritate the airway. You want to avoid them. All right. If the child has anything coming out from the nose, just dry it up. If the child has like thick mucus in the nose and it is not flowing out and the child is struggling to breathe, we can use saline drop to soften the mucus and it to flow out. But there's nothing specific in terms of treatment for cough and catarrh in this age group because most of them are caused by viruses, and we know that they are going to run their course and they're going to stop. In other words, they don't need any drugs, they don't need any treatments. Usually most of them will last like 2 weeks and then that will be the end. But I think the most important thing is to make sure that we prevent. Prevention is a key. We prevent it and we don't allow it to happen in the first instance. But once it happened, you just keep the children warm, keep breastfeeding exclusively, and they will get better. If they're having fever, they're having cough, they're having difficulty with breathing, then you have to take them to the hospital because at that time we have to rule out pneumonia. Pneumonia is a killer, it's one of the childhood killer diseases, and pneumonia is not just cough and catarrh. In pneumonia, there will be fever, the child will be breathing fast, they'll be breathing with difficulties. So at that point, usually we'll have to treat the child with antibiotics. So, but before then, that is not necessary. So, just keep breastfeeding and avoid people with colds and cough because that's how a 2 months old gets cold and cough. Somebody else brought it to the house, so we have to avoid that. Okay. If I might say, how can I handle scalp reactions after babying for my 2-year-old son? Ian is I use one clip and he seems to get this reaction. Number one, you have to make sure that that clipper is sterilized, is washed and sterilized properly, and the child should not be having any reaction after using clippers, and also that the mechanism of when bobbing the hair, they need to make sure that they are not kind of uh, causing minor cuts on the scalp itself. Actually, if it is too, if they are kind of, making the cut so low, and sometimes children don't, they are very fidgety when they're having their hair cut, so and they may be moving, and if somebody is not patient and using the clippers, they can nick them here and there, and that can cause predispose them to not having infection. But the most important, then also, it's not just the clippers. What about the combs? Everything you use on the children's hair, they need to be washed, they need to be sterilized, and the person doing the haircuts need to wash their hands because they've touched other people's head and all that. They need to wash their hands. And I know some of them use all these sterilizers, and they also put in like spirits and all that. You just have to make sure everything used for that child is clean and sterilized, and then the person also doing the job is washing their hands with soap and water and all that. So, and then even in between the haircuts, you're making sure you are washing their hair with appropriate hair shampoo and combing it out and using oil to moisturize the scalp. So there shouldn't be reactions if all those precautions are being followed. But if your child already had reaction that has to be treated, then you got to see a doctor about that, because if there's already infection, whether fungal, bacteria, that has to be treated, and then we can take it up from there. All right. I got a question on Instagram. I'll just quickly take that question on Instagram. Good evening, Miss Lovis. Is it Lovis? My son makes it sound like a deep breath while sleeping. He's 3 years old. I'm not sure whether that should be a problem. I don't see, unless I don't know what you're describing. I mean, taking a deep breath while you're sleeping, I guess that should be normal. I don't, unless there's something that you're trying to describe and you're not using the right words. But I won't worry about somebody just breathing, even if they take it as a deep breath. It's not a big deal. The child is breathing. I think I will worry if the child stop breathing. If the child is not breathing at all, or they take a break and they didn't breathe, and then they start to breathe again, what we call obstructive sleep apnea. That is, I think that's what worries us when the children don't breathe when they're sleeping, or they pause, they're breathing and then they start again. But child breathing deeply in their sleep, nothing to worry about. I won't worry about it. Um, Okay, let's go to blessings. And what meal is good for a age of 3 years old and above? The same meal you eat is the same food you eat as adults. Anything that is good for you is good for your child. So just the same food. There's no special food for children at 3, even at 1, at 2. They should eat the same thing the family eats. So the question is, what are you eating as well? So there is no special food that is good. Children should be eating all the food, and they should be eating variety of food. So it's not a matter of there's one special food and that's the only thing the child should be eating. That is actually wrong. There's nothing like a best food or a best meal. The key is variety. The key is the right proportion. So because if I go into that now, that would be 1 hour lecture. So which we have done several times. We've talked about nutrition a lot. It's one of our FAQs, frequently asked questions. So we've talked a lot about nutrition, the different food classes, the carbohydrate, the protein, the fat and the oil and all that, and the way, the proportion they should be mixed, the welfare food, your fruits, your vegetables, even water as well. It's a class on its own. So all those classes, whenever you're giving your children food, you want to make sure that at least 4 of them are present in a plate. And there's what we call my plate. If you Google my plate, it will bring out a plate for you, and it will tell you when you are giving your children's food. That's why some parents actually use those kind of plates to serve food. So you put the carbohydrates in one section, you put the protein, so you will know that you are covering at least 4 of those food classes every point in time. That is important. And then a ratio. So we want more of the carbohydrate, more of the fruits and the veggies, and of course the protein, moderate, and then of course a little bit of the fat and the oil and all that. And the children should always drink water. So the goal is that the children should have different food classes in every meal. So it should not just be only pap and milk or just rice and stew. There should be some veggies there. So you must cut in, whether it's your peas or your carrot, whatever, you must put some veggies, even your green leafy vegetables, you must have all those things there. And it should also not be the same food all the time. So the same different kind of food classes in one plate, but each plate, like for breakfast, for lunch, for dinner, should be different as well. So if we are doing, like, let's say we're doing pap and akara and milk, and maybe we should have maybe cutting banana into the pap or something like that. That is one kind of food, but it should not be that same thing the child should have for lunch. So for lunch, we say, okay, let's do potato, let's put a little bit of crayfish, and let's put let's cut green leaves into the maybe potato porridge, and with the fish and all that. So you make it different, all the different food classes. That's what you need to know. And then how you now mix them together is your own choice. And like I said, every family, every culture, you have your staple food, you have things you like to eat. But the most important is you always understand the principles. Once you get the principles of what you're trying to achieve, how the ratio of what you're trying to mix together, what you now put in each of those sections of the plate at every meal is your choice. But it was something for you to know, these are the carbohydrates, these are the protein, these are the fat and oil, these are the veggies, and then each time you vary it. So I usually don't give parents food timetable. Each person should make your own timetable based on what you eat, once you understand the principles, and that is the goal. So there's nothing like a special food. There's nothing like a special milk. There's nothing like anything special. Children should be eating everything you have in your kitchen, but in the right proportion, variety, and the right frequency. I hope. And then obviously children should also have snacks in between, and healthy snacks, not junk. So I hope that is clear. All right. Yeah, okay. So going back, this Miss Lovett, it's difficult to appreciate what you're describing. So, but I would say that if you're worried about it, take a video of it and show your doctor. You can go to the hospital and show a doctor. So it's sometimes a picture or a video is worth 1,000 words. So like I said, we will not worry about a child who is breathing, whether it's a deep breath or it's a shallow breath. The child is breathing, everybody is happy with that. What we are worried about is if the child is not breathing. Okay, there's nothing wrong with the child breathing or taking a deep breath and all that in the sleep. That is fine. But if there's more to it and you're worried there's more to it, just go see a doctor. At least if they see it, then they can tell you, oh, it's normal, and then you can your mind will be at rest. Okay, Oluwadamilola Odebanjo. Good evening. My baby clocked 3 months. She weighed 5.5. The person said her weight is small. What was her birth weight? Okay, baby was 4 kilo at birth. Definitely, your baby was 4 kilo at birth, and at 3 months, your baby is only weighing 5.5. Yeah, definitely that is small because your baby was very big at birth. So there are many possibilities here. Is that your baby was the weight is wrong, there could be human error in measurements. Was the baby weigh at the same place the baby was weighed at birth? Is it 4 kilo? Is it the same scale? Because scale differences, scale errors can happen, or it could be the child is not gaining weight well. Okay. I would not recommend that you give a formula. I would recommend you breastfeed your baby exclusively. When the baby is not gaining weight, the solution is not jumping to the formula. The solution is not giving her extra thing. As we have we established the fact that you are not breastfeeding or you are not making milk, so why are we jumping to the formula? The best thing to feed your baby is still your breast milk, okay? And what you need to do is to make sure you are feeding your baby frequently and all and on demand. So make sure you are breastfeeding exclusively and on demand. So at least your baby should be sucking not less than every 3 hours minimum. Okay, or at most 4 hours interval. So the baby should be sucking at least 6 to 8 times a day, and make sure that the baby is empty the breast. Okay, so when you finish with one breast, you change to the other breast. Okay, you alternate the breast. Make sure you are drinking fluid yourself. Make sure you are not giving water. So when we say exclusive breastfeeding, it means breast milk only. A lot of mothers and even grandmothers will be giving the baby water. Water is 0 calories. So if you're giving your baby water, baby's tummy will be full and baby will not be sucking, but baby is not getting any calories. So baby will not be gaining weight. Okay. So it's important that you're breastfeeding your baby frequently, on demand, no water, no formula, no drugs, nothing else. Just breast milk only. Breast milk is demand and supply principle. The more your baby suck, the more milk you produce. If you don't breastfeed, the baby will not. The milk will reduce. So the solution is to make sure your baby is sucking well, and then you go recheck the weight again. Because, like I said, we have to be sure there's also no scale error here. So for me, first time I'm going to check that baby's weight again, and make sure we're using the same scale, and just to be sure. But definitely, your baby should be getting roughly around 30 grams a day. So that should be at 900 grams a week, a month. So at 3 months, your baby should at least have added not less than 2 kilos. So, which means your baby should weigh not less than 6.5 kilos. So, definitely 5.5 is low, but we need to make sure it's not a scale error. And number two, we need to make sure you are breastfeeding your baby as often. There's nothing else to boost your baby's weight. Breast milk is still the breast milk that the baby needs. Okay. He said it's normal for a 3 months baby to pull like 4 times a day. Yes, that is normal. Baby can pull up to 12 times a day, and that is also normal. And it is not teething. And please do not give any teething so-called teething mixture, teething powder, teething medication. Don't give. And so your baby passing stool 4 times a day is normal, 12 times a day is normal, as long as it's normal stool, okay? But don't give anything else. All right, Abiadun Christiana say, I noticed I use a new hair freshener in my room. Your baby has blood clot. You should not be using sprays. I think we've said that before. I'm not sure you've not had that. If you have a newborn baby, you should not be spraying any rubbish in the room. Even your perfume sometimes it can irritate their airway. So if you want to fleet your room and all those kind of stuff, you have to take the baby out of the room and make sure all the smell is gone before you bring the baby back. Okay, most mothers that have newborn babies, all those your baby smell alone is enough air freshener for your room. The house always smells the baby, so you don't need to put air freshener. What are you trying to freshen? Okay, so avoid those things. It will irritate the baby's hair. We don't want you to do that at all. So please stop using it. It's something we should all know as well. The same thing with people that use mosquito sprays. If you are going to use it, you have to take baby out of the house. You have to make sure the old room it become odorless. All the smells are gone before you bring the baby back. You must ventilate the house very well. So avoid using all those sprays. Even some perfumes, they are too strong for babies. They are very irritating for them. So you have to avoid them as well. The same thing with cigarette smoke. The same thing with taking your baby to the kitchen. So you don't want your kitchen close to your room where the baby is, and don't take the baby to the kitchen when you're frying oil, frying this. Also make sure your generator is not close to where the baby is. The fumes, it irritates the airway. Make sure nobody is smoking in the house. No spraying, nothing. And for those of you that also want to spray the babies with baby cologne, please don't. All those things are wrong. I don't know where we get all those you must give baby cologne. Baby does not need any cologne. Wash the baby and let them be clean. They don't need any special smell. Okay, and so maybe you can use your normal baby products, they are fine. So maybe are even allergic even to those baby products, all those. So you must use all the odorless, your Vaseline, Blue Seal without any perfume, without anything. That they, some babies have very sensitive skin, very sensitive everything. So you have to avoid all those things in such babies at that time. So the solution is very straightforward. You just stop and that's the baby will be fine. You don't need to give any particular medication. Maybe it's 5 months old, weight is 8 kilo. Can I start giving her PAP? No. The PAP is from 6 months. There is no extra advantage to doing the wrong thing. I don't know why we always ask these questions all the time. So we've already know there's the right thing, but you want to ask why you can break the rule and do the wrong thing. No, there's no advantage. So for doctors and pediatricians, when people say this is what we want you to do, we don't just make those statements because we just feel like making those statements. Trust me, there are a lot of researches that go into each recommendation that is made. They are what we call evidence-based. So people have done research. Should we be giving babies food at 4 months or should we be doing it at 6 months? People do research, years of research. Thousands of babies will be involved. All those things are done. We'll call them randomized control trials. There are medical evidence that we have to back up every decision we make. So we don't just make those recommendations lightly. We have reasons for saying this is what you should do. So if we have said that based on those evidence, the best time to introduce your baby to solid is from 6 months. Trust me, just stay and do 6 months. There's no extra advantage because at the end of the day, you are still going to come back to us when there is problem because you did not listen to us doing the right thing in the first place. So I always say, mothers, just do the right thing in the first place because at the end of the day, it's the same pediatrician that you are not listening to that you're still going to come to us when babies are having issues to come and solve. So we'll still come back to square one. So complementary feeding is from 6 months. That is the best time that the baby's digestive system is able to handle solids. There is no extra advantage to you starting it a day or a week earlier than it is recommended. And I don't see any reason why you want to rush in this baby now. Okay, you've been using your BP medication, you've been breastfeeding your baby, it doesn't stop you from breastfeeding. I know you are getting tired, but you have just 1 month left. So keep breastfeeding your baby exclusively for 6 months. From 6 months, you can start. You keep breastfeeding, remember, but you're only going to hard. Most of us always look at exclusive breastfeeding as if, oh, once it's 6 months, then I can take a break. You're actually not taking a break. You're actually continuing to breastfeed the same way. You're only adding other things. So, but which is the problem? Most of us just want to replace the breast milk. And that is why babies start having issues, they start getting sick, they start coming to us because we are not doing it right. So please do the right thing. And you will also have peace of mind because you will not need to come and be seeing pediatrician all the time because your baby is sick. So I hope that is helpful. So Agunloyo Olubunmi, you BP medication does not affect your lactation. BP medication is either you can breastfeed with them or you cannot breastfeed with them. And usually most doctors, when we prescribe BP medication, we will prescribe the one that is compatible with breastfeeding. We won't give you something like diuretics or things like that. We will give you one that you can use and you can breastfeed well. So a lot of mothers have high blood pressure, pregnancy, and they have to breastfeed. And we give them medication that they can use. And I'm sure you've been using them because your baby's been gaining weight well. So just keep breastfeeding. And when your baby is 6 months old, you can now start complementary feeds. Remember, you keep breastfeeding as well. Okay, somebody said, my baby, what can I use for dry skin in babies? So that's a very generic question, but basically, I also answer it in a generic way, which means you just use emollients, moisturizer, something to, apply it. And I think the key is that most of us think we should apply cream to the baby's skin once a day in the morning after the bath. Actually, if your baby has dry skin, you may need to apply those moisturizer several times a day. And please use something that is hypoallergenic. Use your Vaseline, Blue Seal, your oil, something that can trap water into the skin, of the children. Don't apply powder to the skin. Some of us will use the right thing, they will not apply powder on top. No, powder will dry the skin of baby. So don't use powder at all. Just use something that will moisturize the skin. Preferably something hypoallergenic. And if your baby is still having very dry skin, some of those babies you may actually they have atopic eczema and all that. You may have to see the dermatologist or the pediatrician for additional stuff. But most babies, if just normal dry skin, just using very hypoallergenic moisturizers will do. That's what we recommend. Okay, my time is up. I just need to rush through the last set of questions and then I'll be off. And then but if you still have your question, you can always post it on our Facebook group. What can I use to cure eczema? Is it eczema in a 2-month-old baby? Because pseudocream is not the treatment for eczema. I also don't take parents' diagnosis. I would rather you tell me my baby has skin rashes or maybe skin is dry. I don't want you to use medical jargons because you may not be using them correctly. So because of that, I will recommend first that let's a doctor see the baby, or if you post a picture of that skin changes or skin rashes to us, our dermatologist can have a look and advise you further, but avoid making self-diagnosis. There are many kind of rashes in babies. They are not all eczema. And sometimes parents think they are all the same. They are not. Some of them are due to fungal infection. Some of them are due to bacterial infection. Some of them are like dry skin, and some of them are like atopic eczema. So there are different things. So some of them actually reaction to the products you have been using, which you should not have been using. So we want to be sure what we're dealing with first. So before we make recommendation, and pseudocream is not a treatment for any skin rash. Pseudocream is more like a nappy nappy rash prevention kind of a thing. So we use it. So it's not a treatment. So you should make sure first we'll see this so-called eczema and let us decide what it is, and then we can tell you what to do. Otherwise, we may be giving the wrong advice. But generally, moisturize your baby's skin. Use things that are baby will not react to, hypoallergenic, and that's what we recommend for now. Hokbayemi, my baby has cough. Okay, I think I've answered the cough questions today. Always start the question with the age of your baby. You didn't tell us the age of your child. Your baby has been treated with antibiotics. I don't have a context for this baby, so I'm not able to advise you further on that. So, but if you see have any clarification, just ask, or you may ask on our group. But please start with the age of your child and put context. Can a 2-week-old baby have kata and still be okay? I guess everybody can have kata. Yeah, I'm not quite sure what you mean by can baby still be okay. Maybe it's okay. I'm not sure what you mean by okay. So I'm not quite sure I know how to respond to that. But if you meant that does the baby needs any treatment or anything, no. Most cough and catarrh in babies are due to viruses, and most of the time they don't require any treatment. Most of them are going to go on their own. Most important thing is that you are breastfeeding your baby, you are keeping them away from people with cold and cough and catarrh. All the people that are coming to greet you, they are coming to greet you and not the baby. So stop giving baby to everybody, because all of them are coughing and sneezing to the baby. They are dropping those germs on the baby. And that's how baby get those germs, because baby is at home. Baby is not going anywhere. So it's people that are coming to the house, or the siblings giving the baby the cough and the catarrh. Most of them are viruses, luckily. But if there's fever, if there's fast breathing, if there's difficulty with breathing, then you have to go to the hospital. Okay, so that's just our advice in that case. Jennifer, okay, but what advice do you give to me? Maybe it's having dry skin. Okay, I think we've answered dry skin question a lot. So we've talked about moisturizing. Coconut oil is okay. Shea butter is okay. Vaseline Blue Seal is okay. What's it called? Sebamed product is okay. So there are many moisturizers for babies with sensitive skin in the market. So just make sure you get the original anyway. And if you're not sure, you don't want to spend much money, use your natural, the normal ori, the one without anything added, the normal coconut oil and all that. The key is keeping the skin moisturized all the time and not using powder, because a lot of mothers use powder on the skin of the baby. Those powder will always make it worse. They dry up the skin. Stop putting powder on newborn babies. Stop putting it anywhere. They don't need powders. They need something that will keep their skin moisturized, that will lock water into their skin. So that is the key. And it's not a once-off thing. It's not like you do it in the morning and that is the end. You can moisturize the skin multiple times throughout the day. And if you see having difficulties, then you can now come and see the pediatrician or dermatologist. Sometimes there are even some that you can put a little bit of oil in the baby's bath water when you're bathing them. So it's all part of keeping the skin moisturized. So that's the key. Yeah. Okay. So the sibling has cough and catarrh. Try and keep them away from the newborn baby. It's not compulsory they must kiss the baby. They must carry the baby. I know it sounds a little bit harsh, but the truth is that these babies, newborn babies, are very, very fragile. They don't have so much resistance against germs. They are still developing their antibodies, they're still developing those immunity. So any little thing you pass to them, they are going to catch it. So we want them protected from people who have those people that have this, and they've been exposed to it so multiple times, so they are used to it. Doesn't bother. It may not even be causing any problem for them, but for a newborn baby, it's a big deal. So anybody that must touch a newborn baby should wash their hands. They don't have to carry the baby. They don't have to kiss the baby, sneeze into the baby. Just keep them away as much as you can. I know it's difficult, but that is the solution, really. Avoidance. All right, my time is up. I need to go. Thank you so much for joining me. But if you still have any questions on any issues, Major Evers, thank you for joining us. I'm just saying you now. But if you still have any question on any of these issues, you can always post it on our Facebook group Mondays to Saturdays. I don't think there's any topic that we've not taken a full lecture on. So if you go to our Facebook page, all the videos. If you go to the YouTube channel, ATP TV, or if you go to our Instagram TV, our podcast channels, you can just search or go on our website, www.askthepediatricians.com. If you put in any of this topic, the cough and catarrh, respiratory infection, or you put in the complementary feeding and all those things, it will bring the real topic for you, the video or the article, or the audio podcast. So you can listen in greater details, all the explanation, and then you'll be able to take more information. And if you have any topic you search on our site and you don't think we have addressed it before, which I strongly doubt, but feel free to send us a message on Facebook, or send us a email, askthepediatricians@gmail.com, and then I can always come and do a teaching on them, in future. So thank you so much, everyone. Have a wonderful evening. I'll see you same time next week. It's bye for now. Bye-bye.